This is VOA Africa.
Hello, I'm Esther Githui-Ewart. It's Wednesday, February 3rd. This is Africa 54. Due to the global outbreak of coronavirus, Voice of America is taking every necessary precaution to safeguard its employees, so our broadcast will look different today and in the near future as we, out of an abundance of caution, reduce our staffing at VOA headquarters here in Washington. We're working to help keep you informed about what's going on, and we appreciate you staying with us on Africa 54. Amid a second wave of coronavirus infections, hospitals in Nigeria's capital, Abuja, are close to running out of oxygen as demand has increased in Lagos sevenfold. Angela Okumadu reports.
In Nigeria's hospitals, the ability to help people to breathe is under threat. A second wave of coronavirus infections has caused nationwide oxygen shortages. Hospitals in the capital, Abuja, have come close to running out, and demand has increased in Lagos sevenfold since early autumn. One patient who spent a week on a COVID-19 wing in Lagos recalls the clanging sounds of canisters and the whoops of joy when a patient secured one of the few available tanks. Her words are spoken for her to protect her identity.
The most important thing while you were in the COVID ward for a lot of patients there was the access to oxygen.
The second wave of infections has hit Nigeria hard. More than half of over 130,000 confirmed cases have been logged in the past 3 months alone. Akin Abayomi is the health commissioner for Lagos State.
Our use ranges from day to day from 250 to up to 500 cylinders, depending on how many patients we have that need very high level oxygen and how many patients are in the intensive care where they use a lot of oxygen. So there was global scarcity of oxygen. There was national scarcity of oxygen.
He said authorities have been getting oxygen from their usual suppliers and seeking new ones.
It was very scarce, and it was really a terrible situation and it has become a norm somehow.
Declan Eugene, a dealer who supplies hospitals in Abuja, said the country's unreliable power supply meant oxygen plants struggled in November as demand soared. He said the supply has improved this year with more plants working at full capacity. Lagos has launched a new oxygen plant that can fill 60 cylinders a day and plans to build 2 more. And authorities pledged last month to build a new oxygen plant in each of Nigeria's 36 states.
Angela Okumadu of Reuters filed that report. 5 vehicles crashed on a highway in western Uganda Tuesday night, killing at least 32 people and injuring 5 others, according to multiple accounts of the accident. Irene Nakasiita, communications officer of Uganda Red Cross Society, says the accident occurred on Fort Portal-Kasese highway, a narrow roadway under construction in the Kasese district. Initial reports indicate a speeding truck carrying a coffin for a burial collided with another car before a third vehicle carrying several people slammed into the pileup, and 2 other drivers lost control and rammed into the wrecked vehicles. Uganda's Daily Monitor newspaper spoke with a witness who described the crash as a chain reaction accident. Heavy rains have left hundreds of Zimbabweans homeless after their homes built on wetlands flooded. Authorities are refusing to help, saying those left homeless are squatters who illegally built on the wetlands. Columbus Mavunga has our report.
Adeline Gweshe is among hundreds of Zimbabweans left homeless after heavy rains flooded their homes on wetlands. She says she bought this piece of wetland to build her home 10 years ago from a person people here call a land baron.
And they said there's no other way, and this is only the vacancies we've got. So I was not having any option, so I took it. So I don't blame anyone, I blame myself. But what I just need is any help they can give me.
Gweshe now wants a home in a drier area. The floods prompted United Nations aid agencies to warn about possible waterborne diseases. They are also urging the government to resettle those left homeless, but first to evacuate them from the flood zones.
From our side as the humanitarian actors, we are more concerned about identification of potential evacuation centers and ensuring that those evacuation centers have got adequate materials and supplies to be able to support them during the time of evacuation.
Images of the flooding have filled social media. This led government officials to visit the area where they said those left homeless illegally built on the wetlands.
We have to get clearance from EMA, from the Ministry of Environment, to make sure that we are not building in wetlands. So this is totally unusual. It's not our planning model, and that's why we know that there is corrective measures that have to be taken.
Destroying illegal structures may be among the corrective measures, added the government minister. For Adeline Gweshe and others left homeless, it's still unclear where they will live next. Columbus Mavunga for VOA News, Chitungwiza, Zimbabwe.
Many children in Burkina Faso who are forced to leave school following threats by Islamic militants are working in the country's informal gold mines where they are at risk of accidents. Henry Wilkins reports from one of Burkina Faso's largest informal gold mines.
Here in Buda, in northern Burkina Faso, miners eke out a meagre living working in dangerous conditions. Burkina Faso is Africa's fifth largest gold producer, but between 700 and 1,000 of its mines are informal. Children are among those working at these sites. Among them, as is Zabre, who left school 2 years ago to become a miner.
I was at school, but I couldn't make money. I followed my friends to this mine. When I get gold, I can make $90 a month. I give some to my parents, and I keep the rest for my needs.
An estimated 20,000 children work in Burkina Faso's gold mines. The owner of this mine says children will turn to crime if they have no other opportunities, but admits the situation is not ideal.
Yes, of course it's good for kids to be at school. I even have some children at school.
Ruki Ganame fled her hometown in northern Burkina Faso when Islamist militants arrived. Now, at 13, she's a miner.
We were at school when these people came with covered faces, but they didn't get us because we left our classes quickly. My family and I left Soman to go to Ouagadougou and from there to Buda, where we are working at this mine.
But the mines are not safe from terrorists either. Militants attack them and demand a cut of the revenue to fund their fight against the Burkina Faso government. Meanwhile, efforts are underway to help children forced to leave school by the conflict. UN representatives say they are taking a multifaceted approach to return all the country's children back to school.
We support the formation of policies, we support training, we support actors in the municipalities to carry out a plan that's sensitive to children's rights.
The plight of these children has attracted funding, a pledge of 59 million recently from an international NGO.
We look forward to working with all of you to tell the world about the situation, the challenges, the suffering, and steer the moral conscience of the rest of the world.
The money will help, says Burkina Faso's education minister.
This will provide for restoration of existing school infrastructures and new construction to allow internally displaced students to be able to go to school. It'll pay for food for the students, and it will help to support girls who are generally left behind and students who have dropped out of school due to gold mining, so they may also attend school.
As for Ruki Ganami, she sees little hope of returning to school soon.
I want to go to school, but I can't afford to ride the bus. It's too far from here to town on foot.
Henry Wilkins for VOA News, Buda, Burkina Faso.
In our tech news, running an e-commerce business is a challenge in most African countries. Due to the COVID pandemic, small companies and startups are embracing new ways of doing business as they fight for competition amid a growing demand by consumers for online services. In Uganda, Doppler Technologies and Innovations has created a Jalule platform that helps small businesses keep an online presence. Africa 54 tech correspondent Paul Ndiho spoke to Donald Waruhanga, the CEO of Doppler Technologies.
Donald Waruhanga, welcome to Africa 54.
Thank you, Paul. I'm glad to be here.
You are one of those innovative young people in Kampala. Bring me up to speed. What have you been up to lately?
Our team here at Doppler Technologies, which I lead, participated in the Africa Development Bank Challenge, and we emerged as a top 20 winners with an idea to support businesses to increase sales, get clients, and adopt remote operations.
During this time of COVID, a lot of businesses have had to change their ways of doing business. A lot of businesses have gone online. You have created a platform where you support some of these businesses. How is that going?
We've supported now up to over 20 businesses, and when we look at their sales, when we look at the inquiries they're getting from clients, it's really promising, and they're also happy because even before COVID, they were not getting such inquiries from online platforms.
Are these more of e-commerce businesses that sprung up during this lockdown and COVID?
These were businesses that were existing before, but the lockdown that was imposed here in March had a big toll on most of these businesses. So they later realized that they could actually tap into online platforms to reach clients because some of their shops were closed, some of their workers were laid off. So what we are telling them is that it is still possible to get back on your feet even after COVID had devastated them.
Interesting. Are there some businesses that you've helped that are doing very, very well?
We have now an events company that's really doing well. They are getting their online. It's called 236 Events. They're getting their orders online. We have a tourism business. It's called Gorillas and Beyond. They are now getting clients when others are still trying to recover from the effects of last year. They are already doing trips. They have tourists coming in, and they're already making money. So we have a clinic. It's called Run Dental Clinic that has been getting also clients through the social media platforms.
You've also worked on other applications that are saving lives. For example, you have one where you help young women who are pregnant maybe to access the nearest healthcare facilities. Can you speak to that?
We developed an app called Getting under the UNFPA Global Hackathon, the United Nations Population Fund.
Okay.
And we have been able to now roll it out in 7 districts where we train village health workers and midwives, and then we rolled out this application, and then we saw these people actually reach out to these young pregnant girls. So what Getting does is that it enables the healthcare workers to follow up teenage pregnant girls and ensure that they give birth to at a health facility.
A lot of people, even here in the United States or in the Western world, are skeptical about these new technologies. I'm wondering from your vantage point, in Uganda where you are, how are people embracing these new technologies?
I think all we have the same problem. Every time something new comes up, people are still skeptical about it. But our motto has been that we want to interest people in the things they are familiar with, like social media platforms. So when you tell them that part of this will be working with your existing social media page or group, then they feel a bit more comfortable, and then you introduce the whole idea with time. But it is still a general problem, but that's how we are working around it.
Well, Donald, thank you so much for your time.
Thank you for...
That was Africa 54's tech correspondent Paul Ndiho speaking to Donald Waruhanga, CEO, Doppler Technologies in Kampala, Uganda. We're excited to hear what you think about Africa 54 and the stories we cover during the discussion on Facebook. The address is Africa 54. We're also streaming our broadcast live on Facebook. Please watch and share our show with your friends. Also, check out our headlines 24/7 on voaafrica.com. Coming up, why did Australia pull out of a cricket tour in South Africa? We'll have the details after a short break. Stay with us.
Hello, welcome to Straight Talk Africa, live from the Voice of America headquarters here in Washington. I am Shaka Sali. Straight Talk Africa, we call it like it is. We discuss issues that reflect the interests of our audience without fear or favor. We are guided by facts, and I look at myself as a servant of nothing but the truth.
Welcome back to Africa 54. Britain is launching an emergency door-to-door testing program in several parts of the country following the discovery of numerous cases of the coronavirus variant first identified in South Africa. Scientists say the variant could be more resistant to vaccines, as Henry Ridgell explains from London.
Emergency testing programs were rolled out in 8 districts across Britain Tuesday, hours after scientists confirmed 105 cases of the coronavirus mutation first seen in South Africa. 11 of those cases don't have a direct link to international travel, suggesting the variant is being transmitted within the community. Local authorities aim to conduct 80,000 door-to-door COVID tests.
Our mission must be to stop its spread altogether and break those chains of transmission.
The British government urged people in the affected areas to stay at home.
Well, yes, I think we all are very concerned and just have to keep safe.
Britain had already identified another mutation of the coronavirus that emerged in Kent in southern England in the fall and contributed to a deadly second wave of the pandemic. Both the Kent and South African variants appear to be more transmissible. And there's another difference that's causing major concern.
A mutation which renders antibodies less able to bind to the spike protein and stop the spike protein acting as a key to gain entrance to our cells.
That could affect people's immunity to the coronavirus, both for individuals who have had the disease and those who have been vaccinated.
Even if we roll out a vaccine across the population, getting complete 100% coverage will be nigh on impossible. It always is. And the virus will be put under a selective pressure to accommodate and to favour mutations like this, which render it less susceptible to vaccines or the actions of vaccines. So I doubt this is the last time we've heard of anything like this.
Britain announced Tuesday it had given a first vaccine dose to more than 10 million people, by far the highest in Europe. But it's not yet clear if the vaccines are as effective against the new variants, and they may need to be modified.
We're working with pharmaceutical companies and with the scientists to understand both whether such modifications are needed, where they are needed, and how they can be brought to use on the front line as quickly as safely possible.
South Africa, meanwhile, took delivery of its first shipment of the AstraZeneca vaccine Monday. Scientists say the emergence of new variants around the world underlines the urgent need to roll out global vaccination programs and suppress transmission, as even fully vaccinated populations could be at risk as the virus continues to mutate. Henry Ridgewell for VOA News, London.
In March 2020, when it became apparent the world was facing a global pandemic, learning institutions closed, creating challenges for both students and teachers. I spoke to Dr. Lucy Ngige, a lecturer at Kenya's Kenyatta University, about how COVID-19 has impacted learning in the East African nation.
At that point in time, there were those candidates who were waiting to do national examinations. So those examinations as well were suspended. When you come to colleges and universities, that meant delayed completion of education and the programs that had been set for the year 2020. Those who were set to graduate also meant that they had to have delayed graduations because some businesses were closed down, which meant that even parents who could pay fees, they had no source of income. And generally also mental health issues increased.
Can you talk a little bit about the young girls, especially getting pregnant, and even some parents marrying them off at an early age because of this impact?
Parents lost their sources of livelihoods. They lost their incomes because even small businesses were closed down. That also meant they're looking for other ways that they can put food on the table. And in Africa, girls are married off and in exchange for dowry. So young girls were married off. Teenage pregnancies increased. And that lack of teacher-pupil physical interaction every day, that also ensures discipline and proper engagement. Moral upbringing, I know, can be done at home, but I think teachers spend so much time with children, and children respect their teachers as role models.
Give us some specifics on how the pandemic has impacted learning at Kenyatta University, where you teach.
The impact of COVID-19 affected all learning institutions. A loss of 6 months to students. And at that time, since the closure was sudden, imminent, the backup plan was not in place at the time. And when you're dealing with undergraduate students, graduate students, postgraduate students, that was very many students leaving at the same time. They had not completed their programs. They could not find jobs. They could not find internships. There was confinement. There were curfews. All these restrictions affected everyone. So students were there at home with no assignments, no work to do. Then on the lecturers and the professors' side, work started remotely. Members of staff were retrained for the first time. I must say, people who have taught physically for 30, 40 years had to learn new digital technology, new methodologies of teaching, preparation of class materials or learning materials online in January 2021. This is what is happening. We have half of the population of the university, because it's quite large. First years and fourth years, the beginners and the finalists are on campus learning physically. Then second years and third years are at home, taking their lessons remotely. And they are also catching up.
Talk to us about the challenges now of online learning for both the students and the lecturers.
So when you think about electricity connection, when you think about internet service provision, not every village, way back in the counties, what we call marginalized areas, has the benefit of having internet connectivity, let alone electricity. Still, that internet has to be paid for. Students require bundles, airtime to be able to attend a class. So again, that has an impact on the finances. At the family level, there is also online examinations. So some students would start perhaps taking a cut, then power goes, disappears. So they would not be able to submit their work on time or even a final examination.
Will there be remedial classes for students who are not able to catch up?
They will have a chance to come to the campus physically to make up for the time lost, so that there is no exclusivity of students because of marginalization of technology.
Dr. Lucy Ngigi is a lecturer at Kenyatta University. Australia has pulled out of a cricket tour in South Africa, which has been battling a second wave of COVID-19 and a more transmissible variant of the virus, in a decision described by the hosts as extremely disappointing. David Doyle reports.
Australia has pulled out of a South African cricket tour scheduled for next month, citing an unacceptable level of health and safety risk due to COVID-19. And it's a decision that's not gone down well with Cricket South Africa. CSA's Director of Cricket, Graham Smith, described it as extremely disappointing, while Chief Medical Officer Dr. Shuaib Mandra said the risk from South Africa's epidemic had come down significantly.
Graham and I and our teams have invested an enormous amount of energy and an enormous amount of money into ensuring that this tour goes ahead. So clearly, I think it's disappointing for all of us that Australia has taken this decision, and very late in the day as well.
South Africa has recorded more than 1.45 million cases and over 44,000 deaths, and since late last year has been battling a more transmissible variant of the virus. Cricket Australia's interim chief executive Nick Hockley said in a statement that they acknowledged the amount of work CSA had put in, but that the safety of their people was the #1 priority. Dr. Mandra complained that CSA had attempted to accommodate Australian requirements, including a private charter into their own terminal with dedicated staff and a biosecure bus to transport the team to a biosecure environment.
Cricket Australia based their decision on zero risk, and I think that zero risk in this world is impossible. We worked on probabilities, they worked on possibilities.
No dates were given on when the tour might take place in the future. The International Cricket Council said the tour's postponement means New Zealand has become the first team to qualify for the inaugural ICC World Test Championship final, which is scheduled to be held in England from June the 18th.
David Doyle of Reuters filed that report. And that's our show for today. Be sure to watch Africa 54 on our website at voaafrica.com. From all of us here in Washington, we thank you for watching.